One of the most frustrating things that can happen is when you're not feeling well, you call your doctor, make an appointment, but sometimes have to wait weeks or months to even be seen. By the time you see them, they order the most basic blood work, a CBC and a metabolic panel, and tell you everything is fine. You are left feeling discouraged, you're still not feeling well, you don't have any answers as to why. You're fatigued, your hair is falling out, you're bloated, you're breaking out, you just don't feel like yourself. We're here to talk about other functional medicine tests that might give you some more answers that you may want to ask your primary care if they can order for you. Oftentimes, they probably still won't, which is why it's really important to try to work with a functional medicine doctor or a naturopathic doctor that are very well versed with all these other tests so that you can hopefully get some answers as to what is going on. Now, on the flip side of the most basic conventional labs, there can be some doctors that get a little bit lab happy and order almost every test under the sun, and that's also not the best way to practice medicine in my opinion, because it can be overwhelming, it can become too much, it can become expensive and just unnecessary. So let's talk about why we even order testing in the first place. Well, we order blood work or tests to figure out what's going on with you, to come up with a diagnosis and then treat you appropriately. But sometimes the tests that we run are to rule out other conditions as well. So let's say someone comes in with joint pain, right? We might order a panel to rule out autoimmune disease, maybe Lyme and co-infections, maybe some inflammatory markers, so we can start to rule things in and rule things out. Now, we also order testing to determine our treatment. So if the result of whatever test we're ordering is not going to change our treatment, then it doesn't even make sense to order that test in the first place. And there are a couple of tests that are like that. So I will be touching upon which tests are, in my opinion, not very necessary because it's not going to change the treatment anyway. There's also something to be said about the reference ranges that are listed on the conventional labs, because there are times when you want the patient to be either on the normal high end or the normal low end. It just depends what we're looking at. Whereas most conventional doctors are just concerned that you fall within the normal range and they don't really care about optimizing you one way or another. The reason that can be somewhat of an issue is because the ranges that they're giving us on these labs are based on the average American, and well, we know the average American is not the most healthy. For example, let's say I order a vitamin D level on a patient. Technically, if they had a level of 40, that would be falling within the normal range, but to me, I still think that is very low. If you don't know, the range of vitamin D is 30 to 100. Anything less than 30, you're deficient. Anything above 100, it's excessive. But I think 40 is still low, so I would want to actually recommend supplementing with vitamin D to boost those levels up to more of an optimal level, which is around 60 to 80. On the flip side, an example where I would want you to actually be on the normal low end of things is your hemoglobin A1C, or your fasting blood glucose, right? Because we don't want you to be getting right up to that high end where it's cutting off with pre-diabetic territory, because we want to be more proactive about that. So these are just some scenarios where maybe you want to work with a naturopath or functional medicine to look at your lab results with more of a scrutinous eye, rather than just saying, hey, your labs look all good, there's no problems here, best of luck. No, we are a little bit more proactive than that, because we don't want to wait until you become pre-diabetic or deficient in some of these vitamins to act. So now I'm going to be touching upon some functional medicine lab tests that are worth it in my opinion, and then I'll talk about the ones that I don't think are as worth it, and I'm going to be talking about a variety of different test results, from blood work to urine to blood. So let's start with the functional medicine tests that I think are very much worth it. So obviously we know that a CBC, a metabolic panel, lipid panel, sugars, like that's all very necessary. We're talking a little bit more about the functional specialty labs. So to begin, I think vitamin and mineral labs are worth it, especially nowadays when we're just not getting the same nutrients that we once did from our foods for a variety of different reasons. Most people I find are deficient when I order these labs, especially vitamin D, which I already talked about, magnesium, zinc, B12, folate. So I definitely want to check, especially if you are a menstruating woman, if you're vegan, vegetarian, chances are you're probably going to be deficient in one of these nutrients, and they can cause a host of symptoms, by the way, such as fatigue, brain fog, headaches, hair loss, body aches, muscle aches, recurring sickness, mental health problems. So really important to make sure that you are optimal in the vitamin and mineral department. One thing I will say about B12 and folate, I would actually recommend looking at homocysteine and MMA or methylmalonic acid levels to really determine if you have a true deficiency or not, especially because the B12 and folate serum levels are not the most accurate. I have seen levels come back high when someone wasn't even taking B12 and folate, and that's an issue where they actually might have some methylation issues occurring, like an MTHFR mutation. So ordering in a homocysteine and an MMA will give us a better idea as to what's going on there and whether we want to do any MTHFR testing or not. A test that actually is very comprehensive, does look at vitamins and minerals, but among other things is the organic acid test or an OAT test. The OAT test also looks at the health of your overall mitochondria. It's looking for any oxidative stress, any inflammation, bacteria, yeast products. It's looking at neurotransmitter breakdown products as well. So the OAT test does give you a good array of all of these things. So that's a really great one to order, especially if you have a lot of different symptoms going on. But I will say insurance doesn't cover this test in a lot of instances. So most people end up paying an out-of-pocket expense, and that can vary anywhere from $300 to $400. The next functional medicine test that I think is worth it is doing a thorough thyroid panel. So what I mean by this is I'm not just going to run a basic TSH or thyroid stimulating hormone, because we could be missing the bigger picture. The TSH is just looking to see what the thyroid stimulating hormone is doing, but it's not letting us know anything about the downstream thyroid hormones such as T3 and T4, and it's also not letting us know if there's any Hashimoto's or autoimmune involvement with the thyroid. So with a full thyroid check, yes, I'm checking TSH, I'm checking T3, I'm checking T4, and I'm also checking those antibodies like TPO and thyroglobulin, just so we can get a full picture. So you might be wondering, well, how does that affect our treatment? Well, if you have positive thyroid antibodies, then I'm going to know that there's some type of autoimmune issue going on that I'm going to want to address, and that might look like doing a lot of work with your diet, maybe even looking into your gut health, because there is a very prominent gut-thyroid connection. Definitely want to be doing a full thyroid panel, especially if you're struggling with fatigue, with weight issues, either losing weight or gaining weight, if you have depression, issues with your GI, constipation or diarrhea, any hair loss, hair thinning. If you're losing the sides of your eyebrows, that's a clear indication that there's something going on with your thyroid. Brittle nails, dry skin, any of these symptoms, definitely get your thyroid checked. The next functional medicine lab markers that I think are worth it are inflammatory markers. However, there is a caveat here because the inflammatory markers aren't very specific. They're highly sensitive, just not specific to where the inflammation is coming from. So the two markers that I order are CRP or C-reactive protein and ESR or sedimentation rate. So these tests just let us know the level of inflammation in the body, because we need to know how much inflammation we're dealing with. That's going to determine how much work we do to actively lower inflammation, whether that's through diet, through supplements, or through LDN, something like that. And it's a good way to track improvement in inflammation as we're doing treatments. So those are two lab markers that I would definitely ask about. The next functional medicine lab marker that I think is worth checking that not a lot of doctors check for some reason is insulin or an insulin resistance panel. This one is really important if you are having a lot of difficulty losing weight, if you have PCOS, or if you're pre-diabetic. So the issue with insulin resistance is that your blood sugar is not entering your cells as efficiently as it once was, leading to higher levels of blood sugar for a longer time. And this can actually exacerbate pre-diabetes, which can then lead to full-blown diabetes, but not in every case. So the insulin resistance can actually be the pre-diabetes. So we want to see if that's going on so that we can be more proactive about hopefully lowering your blood sugar and making your cells more insulin sensitive. And there are a couple of ways of doing that. Definitely a low carb, high protein diet, intermittent fasting, certain supplements like inositol, berberine, chromium, vanadium. So really important to be proactive so that you don't go on and develop prediabetes, and of course to start helping you lose weight, because that is something a lot of women, especially with hormonal imbalances, struggle with. The next functional medicine test that I think is worth it is hormone testing. So for some reason, OBGYNs do not do a lot of hormone testing unless you are in dire circumstance, such as dealing with infertility, going through menopause. But beyond that, they're not really looking at your hormones. And I'm talking about For irregular periods, for cramping, for PMS, they're really not looking at that. And I think there is so much value at looking at hormone tests. So let's talk about which tests I order for these conditions. So if I am wondering about PCOS, in the blood, I'm gonna order two things. I'm gonna order LH and FSH, so luteinizing hormone and follicular stimulating hormone. We are testing this on day 3 of your period. So that's what we wanna check, because we wanna look at the ratio between the two. If the ratio is 2-to-1 or more than that, it's more likely that we're dealing with PCOS. Now, we also want to check the androgens, or the male dominant hormones like testosterone and DHEA. So those I check more in the luteal phase, which is day 19 to 21. And that's also when I'm checking progesterone and estradiol as well. So testosterone and DHEA are still accurate in the blood, but oftentimes I'm doing a salivary hormone test to check for all of the other sex hormones. So we can kind of lump all of those hormones into a saliva hormone test. And again, I would be checking that on days 19, 20, or 21 if you're following a 28-day cycle. If you don't have a normal 28-day cycle, then you want to do the collection roughly 5 days after ovulation. Looking at salivary hormone tests is a little bit more sensitive and accurate because we're looking at the tissue level of the hormones, not just what's circulating in your blood. We're actually seeing how your body is taking up these hormones and using them. Another way that you can evaluate your hormone levels is actually by doing a urine test, such as the Dutch hormone test. So that's looking at hormone metabolites, which is still valid, still very useful. And oh, by the way, these two tests do look at cortisol. I'm about to get into cortisol in a minute, but the salivary and the urine test do look at cortisol. So both of those tests are totally fine to do. For the Dutch, you would still collect during that luteal phase, and they're gonna just have different ranges, but still better than looking at them in the blood, in my opinion. So yeah, those two tests are very important. A big hang up that OBGYNs and other doctors have with testing hormones is that they'll say, well, look, there's no such thing as a hormonal imbalance because our hormones are constantly fluctuating. And while yes, that is true, they fluctuate in a very predictable pattern. That's why we want to make sure that we're looking at the hormone tests in a specific time frame, which is that luteal phase, because the reference range that we're going to get is going to correspond to the levels where they should be during that luteal phase. And oftentimes I'm seeing that women are either deficient in progesterone, they have estrogen dominance, and there are ways that we can address that with diet and supplements. So it's not just go on the pill, let's suppress ovulation so that we suppress all of your symptoms. That is not the answer. There are ways to actually balance your hormones so that you're not having those crazy PMS symptoms or hirsutism, weight gain, irregular periods that come with PCOS. So there's so much that we can do. Don't let your OBGYN convince you that you need to go on the pill for your hormonal imbalance symptoms, because that is just not the case. Let's talk about some functional medicine tests related to gut health that I think are very worth it in my opinion. So you might have already heard me talk about SIBO at length, SIBO being small intestinal bacterial overgrowth. So the way that we test this is by doing a lactulose breath test, which involves drinking about 15 milliliters of lactulose and breathing into a bag and a tube every 30 minutes for about 3 hours. So with this test, we're looking for the presence of hydrogen or methane gas produced by bacteria or archaea in the small intestine. If there is an excess of this bacteria in the small intestine, we will see a spike in both of the gases once we process your samples, and this will let us know that there's an overgrowth of bacteria or archaea in your gut, and that is actually very treatable, which can help significantly reduce symptoms of IBS and then sometimes put it into remission for years. If the SIBO test comes back negative, that's still useful information because we know that although there's no bacterial overgrowth, there's still some imbalance going on. So at that point, I would probably dig deeper with doing a GI map, which is a PCR stool analysis, looking at DNA levels of different bacteria, different organisms, parasites, and I love it because it also looks at intestinal health markers, so how you're digesting your food, if there's any blood in the stool, inflammation in the gut, how your detox capacity is, as well as the degree of leaky gut that's going on. So I love the GI map, and it's not uncommon for me to order the SIBO test and the GI map simultaneously so we can see what's going on throughout the entire GI tract, because again, the SIBO test is looking at the small intestine versus the GI map is looking at the microbiome in the large intestine. So we're getting a pretty good picture again as to what's going on in the entire gut, and we get a holistic picture which will help us determine our treatment best for that patient. So these aren't functional medicine labs, they're regular labs that conventional GI doctors will order, but I figured I'd just mention them. So they might want to order a elastase test to look at the function of your pancreas. They'd order calprotectin, lactoferrin to look for any inflammation and signs of inflammatory bowel disease. They might order H. pylori test, either breath or stool, to rule out a bacteria that can be found in the stomach that can be causing symptoms. And they might also run an ova and parasite parasite, which is just looking for an acute infection. Really quick, want to make the distinction between an ova and parasite test that a GI will order rather than the GI map. So the ova and parasite test is going to look for more of the actual presence of the antigen right here, right now. That's really going to only be helpful if you have an acute GI issue, such as you were fine and all of a sudden you have cramping, you have diarrhea, you're vomiting, you have a fever. That's likely an active infection right here, right now. The GI map is looking more at the DNA levels of multiple species to look for the imbalance in the microbiome, to look at parasites, and it does check for those acute pathogens, but that's not a very reasonable test to do if you just happen to get sick in the moment, because it's going to take 10 days for the GI map to come back. By that point, you would have been still suffering. So definitely, if you're having more acute symptoms, like your symptoms just started today, go to your GI so that they can do an ova and parasite test. Versus if you've been dealing with IBS issues for months or years, the ova parasite test, you might still want to do to rule it out, but likely it's going to be negative. So that's why you want to do a GI map test to look at more of those imbalances that are going on in the microbiome, versus whether it's bacterial overgrowth or not enough of the good bacteria, which is also an issue. All right, now let's talk about functional medicine tests that I don't think are very worth it in my opinion. And this is probably gonna be a little controversial, but this is just my opinion, okay, mine. So the first test that I think is overdone in functional medicine and I don't think is very worth it is the FIT test, or the food intolerance test. So I made a whole nother video about food sensitivity testing. So definitely go check that out if you want a more thorough explanation, but I'll try to explain it very quickly here. Basically what I tell patients is the FIT test is a glorified and expensive way of letting you know if you have leaky gut or not. Let me explain. So if you have leaky gut, which is increased intestinal permeability in the small intestine, food particles are going to get past that barrier that shouldn't. They're going to come in contact with your bloodstream and your immune system, which is going to create antibodies or IgG antibodies against specific foods, and that's what's showing up in your blood when we do the FIT test. So does that mean that that food is causing you a problem? No. It's just telling us that that food that you ate is getting past that intestinal barrier, and your body's creating antibodies so that it can remember that food for the next time you eat it, so it won't cause a crazy response. That's very controversial, and there's still a lot of controversy whether that's true or not. But in my opinion, I think that the FIT test can cause unnecessary food restriction. It can be overwhelming. It's costly. So for me, I think it's a better idea to do a food elimination challenge where you remove specific food groups, the ones that are more likely to cause issues, whether it's wheat, dairy, eggs, corn, nuts, or soy. Remove one or two of those food groups at a time from your diet for about a month. See how you feel, and then reintroduce those foods back in your diet. That is the gold standard for figuring out food sensitivity, and it's less likely to make your diet super restrictive versus doing a 96 food sensitivity test and it's telling you that you're sensitive to like these 20 food groups, and then what are you supposed to eat? So that test I leave for like the very, very last resort if we've done all the other tests that I think are more worth it in my opinion. Or if the patient really wants me to do it, I'll do it, but I'll give them the whole spiel. And at that point, I've convinced them to save their money for a test that I think is more valuable and going to give us more information. Because foods aren't the problem necessarily, except for gluten, which I made a whole nother video about that. It's what's going on in our gut that's making us reactive to these foods. Staying on the theme of food sensitivity tests, any hair analysis or any test that is asking for your hair to look for food sensitivities, to look for hair mineral levels or heavy metal toxins are BS in my opinion. I don't think hair analyses are very accurate at all. I think they're very flawed, especially because it's outside of your body. So there's so much like cross-contamination that can occur. I think that's like the lowest of the lowest totem pole for specialty testing. So I would definitely say avoid any hair analysis, and you want to make sure that if you are looking at food sensitivities, heavy metals, heavy or mineral levels, that you're doing a blood, you're doing serum, or you're doing a urine test. So if you are wondering about heavy metals, this one is not a very common test I order, not because I don't think it's worth it, but because it's not one that I commonly suspect in patients. If you have heavy metal toxicity, you're gonna have very obvious signs. It's not usually gonna be vague symptoms, although those are part of the symptoms, but you're typically gonna be presenting with neurological symptoms as well. So in those cases, I do order a heavy metal panel through Quest, which is blood. And that's gonna look at acute exposures, meaning you're currently actively getting exposed to heavy metals somewhere. If I'm suspecting more of a chronic heavy metal exposure, or you tell me that you were exposed to heavy metals in the past, that's where I would do more of a provocated urine test, because that's actually going to extract any heavy metals in your tissue, which are going to show up in your urine. And again, that's looking at more of a chronic heavy metal toxicity versus an acute current ongoing exposure to heavy metals. Next functional medicine test that a lot of doctors order, which I hardly ever order, is the AM cortisol. So AM cortisol is really just testing your cortisol between 7 a.m. and 9 a.m. And really it's just gonna tell you whether you fall inside of the range or outside of the range. So this test is only useful if you're suspicious for like a cortisol pathology, whether it's Cushing's disease where you have too much cortisol, or Addison's disease where you have like no cortisol. So that's really the only time I'm ordering it, if I'm suspecting something very serious like that. A lot of patients want to order it because they're telling me they feel really stressed, they're fatigued, they have no energy, they're having trouble sleeping, brain fog, yada yada yada. I'm like, okay, well, number one, we would want to look at your cortisol throughout the entire day, not just in the morning, because it could look great in the morning, but what is it doing in the afternoon, the evening, the nighttime? We have no idea. So virtually ordering that AM cortisol was a waste of our time. So that's when I say, let's just look at your hormones with the saliva test or the urine test, which I talked about. And remember, going back to, does this test change our treatment or not? Usually it won't, because if you're telling me you're stressed, you're not sleeping well, you're not exercising, well, we're gonna wanna work on your stress, your sleep quality, and getting you moving a little bit more, right? So like that's not going to change our treatment that much more. Versus if we did the 4-point cortisol throughout the day, we're gonna know if we need to boost up your cortisol during the day, lower it at night, or vice versa. It's just gonna give us a better idea of how we're going to actually balance your cortisol. The last functional medicine test I'm gonna talk about is the mold test, or the mycotoxin test. So I have ordered this test for patients, and I still do, but I do think that the accuracy and the specificity is not awesome for the mycotoxin test. This is usually a urine test, and the reason I don't think it's super reliable is because I've seen it not be super reliable. I've ordered 2 tests on the same patient at the same exact time and had different results come back. It is what it is, okay? And also with the mycotoxin test, it's looking at mold spores, which we can even ingest from our foods, from our drinks, and that's not mold toxicity. Mold toxicity is when you have toxic mold somewhere in your environment and you're constantly getting exposed to that, you're inhaling it, it's getting in your lungs, and it's getting in your body. That's different than, okay, maybe I ate a little bit of a moldy strawberry, but that's still gonna show up positive on the mold test. So that's why it's a little bit tricky. I still will order it if you tell me that you used to be in an environment where there was definitely mold toxicity, to see the degree of mycotoxins in your body, you know, right here and right now. And yes, that will determine if we do a ton of antioxidant, mold detox protocols. But in general, I'm looking at the entire picture, doing more of a clinical assessment if I think you have mold toxicity or not. I'm asking you again about your environment, recent exposures, your symptoms, and really if I feel like you have it, I'm just gonna do an empirical treatment for it to see if your symptoms improve. But the biggest thing with mold toxicity is getting out the environment which is making you sick. That's first and foremost by far. So that is it for functional medicine tests that I think are worth it and not worth it. This was only part 1. I'm sure I'm gonna make a part 2, 3, 4, 5, because there are so many functional medicine tests, but I figured I'd cover the most common ones that I get asked about. Definitely leave a comment if there's any tests that you're wondering. Is it worth it? Is it not worth it? Should I dish out $200 or should I save my money? Definitely comment, I'll be sure to get back to you. Thank you so much again for watching my video. Make sure you subscribe if you haven't, and I will catch you next time.